The anonymous source feels it is not right for the Windhoek Central Hospital management to continue with this practice as it is putting them at risk of contracting COVID-19.
Windhoek Central Hospital management is pressurizing its nurses to be the ones responsible for decontamination of departments which were exposed with COVID-positive patients after the patients have been discharged. Why can't the Ministry of Health put measures in place and have a team of people specifically tasked to do this decontamination every time the department is exposed? When it comes to COVID-19, there's terminal cleaning that needs to be done, which is more than what we are trained to do. It requires different types of chemicals to be utilized and ways to be cleaned. Already the PPEs are limited in provision to departments just for patient care. Will the ministry be able to avail this to us? Because we already know what the situation on the ground is. Please refer to the CDC Namibia as well as World Health Organization in order for you to get appropriate guidelines on how to decontaminate these departments.
In response to the claims, Executive Director of the Ministry of Health and Social Services, Ben Nangombe, said that there are guidelines provided in the risk stratification of health workers, which ensures the possible risk of exposure of each worker is assessed independently by the infection prevention and control teams.
Our health workers are on a daily basis dealing with situations where the risk of exposure is there. So the issue is that people are provided with appropriate health care. There is risk stratification conducted so that the people are not exposed to the risk of infection. We are not saying that people are continuously being brought back. If they clean once, twice a day or 3 times a day, that is the kind of cleaning service that is provided. If however a situation changes and something needs to be done, then the person responsible for whether it is cleaning or interacting with a patient, because maybe a condition of a patient deteriorates, then you need a health professional to be there. And if it is such that there is more cleaning required for whatever reason because of the change in circumstances in a particular facility, then of course the person who is responsible for cleaning will be required to come and do just that. Others will be required to come and do whatever is necessary to ensure that the health of the patient is sustained.
The anonymous source says the fact that they are putting their health at risk is frightening and prefers that the Ministry of Health and Social Services recruits cleaners instead. In response to this, Nangombe said that the health system must continue even in times of COVID-19, and the only people skilled enough to work within the system are the health workers. He said there are methods in place which ensure the health workers are provided with personal protective equipment as well as placed in special facilities to prevent the possible spread of COVID-19.